Today we will be doing hip palpations. First one we are going to locate is the pubic bone. I'm going to search right over here and press, and this should be the location right here. I'm feeling it for a male and female. It's about the same anatomically. And for sake of anatomy, we're not going to show the pubic symphysis, but it's right, maybe pull up a picture of it at the end, and it's right at the end of the ischium and the ischial crest on the bottom and the middle. Would you please stand up for me? Next, we will be locating the adductor muscles. And over here, we're going to place his hip in abduction just along here. These are going to be the adductor muscles. The adductor muscles are composed of the pectineus, longus, brevis, magnus, and brevis. Longus, magnus, brevis, yes. Next thing we are going to look for is the gracilis muscle, and we can see that right here, standing anteriorly. That should be right over here, palpating it. And the gracilis, approximately from the Gerdy's tubercle, this is where I can find it. Next, we're going to be looking for the ASIS. So that should be bilaterally over here on the hip bones. I can feel it. There'll be the bony projections right here, both on the right side and left side. This is the ASIS. Next, the anterior inferior iliac spine. The structure is not always palpable, but that's going to be more proximal to the leg. So that should be right here. Actually, I can feel it on him. He's got an athlete body, so those bony projections are actually easier to find. Next, we're going to be looking for the sartorius. And the sartorius is going to be here, and it's going to run down the leg. And the sartorius performs flexion, abduction, and external rotation of the hip. Next, we're going to be looking for is the rectus femoris. And that's going to be that big muscle right here. That's going to be overlapping on all the ones that we just went to on both legs, right about here. Next, we are going to be looking for the iliac crest, which is the largest of the three bones that make up the pelvis, and they provide attachment for the hip flexors, and they also rotate the hip. And might be a little bit difficult, but that's just going to be right on the iliac crest. It might be easier to find it with the patient standing posterior. Next, we're going to be looking for the greater trochanter. And actually what I'm going to have you do is lay down on your left side. Ah, yes, there you go. And I'm just going to put his knee into flexion over here. And actually I can see that right, I don't know if you can see that. If I put his knee into flexion just a little bit, this should be right here, the greater trochanter, the head, and going down the leg. Thank you. You can remain there, actually. The next landmark we're going to be looking for is, the gluteus medius, and we're going to have his hip abducted also when we're looking at this, and that's going to be right here stretching out. I can see. Could you inch a little bit closer here so we can see you? Perfect. Yeah, so we're just going to abduct his hip 10 to 15 degrees, and I can see right here, this is the gluteus medius. And the gluteus medius tends to get confused with the TFL, the tensor fasciae latae, and that's actually in the front over here. This is going to go right. Yeah, I can feel that right over here. and this is gonna be right in front of the gluteus medius and then the maximus in the back. Thank you. Next thing we're going to be looking for is the IT band. And the IT band, we can actually find it in the place that he's in right now. This is going to be running down from the hip all the way down to the knee. And once I put his hip into adduction, you can actually see it better going down to the knee. Next thing we're going to be looking for are the median sacral crests. Could you stand up for me, please? Have your patient stand posterior, and you'll be able to find, actually, please move this way, beautiful, posterior, and you'll be able to find these landmarks better. So the median sacral crest is going to be right here. And the median sacral crests basically are located on, this is the dorsal surface of the sacrum right here. Next thing we're going to be looking for is the PSIS. And we're looking to see if both of them are equal bilaterally, which if I feel right here, this is both the projections of the PSIS. And looking at his gait, his legs are looking the same and equal sizing. The next thing we're going to be looking for, and lastly, is the ischial tuberosity. And that is basically a rounded bone that extends from the ischium. And we can find that right here. Here, and on this side, right here. Thank you.